Hi everyone, I'm here with the lovely Chloe Sims. I should have my own talk show, shouldn't I?
You should.
I'd be a really great talk show host, except that I only talk about one topic, like my one topic, just cosmetic stuff all the time. So it'd probably go for like, one season, one episode, something like that. We're gonna talk a little bit about, the time when I removed your fillers, because people ask me about that all the time, don't they?
Yeah.
And I was going to talk about that because a lot of people don't really know that you can have fillers removed or how it works and stuff. And sometimes people actually say like, oh, can you remove fillers like what Chloe Sims had done? And I'm like, yeah, I pretty much can. I did that. I remember doing that for her.
Yeah.
So I was going to just get you to talk about it a little bit. Like, it was a few years ago, wasn't it?
Yeah. To be honest, I'm not surprised that people aren't aware that you can have them removed, because I wasn't aware, and it wasn't until I met you and you said that you could actually take them out. I was really surprised, because I just thought that you had to naturally wait for them to disintegrate, which, as me and you both know, they did start to disappear, but they left various lumps.
Yeah.
And when people have their lips done, you can sometimes see that one side's different to the other. Like it's worn off quicker on one side and stayed on the other.
Mm-hmm.
And I was completely unaware that there was something you could do to remove them. So obviously when you said that, I was over the moon, because we do these things and then we change our mind.
Yeah.
And obviously I was really unhappy with the fillers that I'd had, and I was really happy to do a procedure to get rid of them. And also it was a really easy procedure. It was pretty much a few injections, and then I remember being on the train on the way home and feeling like my lips actually deflating, like it was really weird.
They were like going down while you were on your way home, weren't they?
Yeah, it was really, because you said it could take up to 6 hours.
It could take a few hours, even up to a couple of days. I never really know when they're all going to go, but they started quite quick in your case.
It went really quick, yeah. I mean, by the time I'd left here and got back to Essex, my lips had deflated.
Yeah.
So it was crazy. Yeah.
So you basically, like, by the time you got home, you had a whole new look going on.
Yeah.
And the other thing about the fillers it's kind of probably because you had a few different procedures, didn't you? And just adding fillers to different fillers.
I think a lot of women probably would be the same as I was at the time, and you'd probably just go where it was cheapest or your local areas, not really research into who really is qualified to do this. And personally, I went to a few different beauty salons where they was performing these procedures, and then they all use different products. So say it was like a build-up of, 4 different people and 4 different products.
And everyone's got their own techniques, and then the timing might not be quite right, and that's where you start getting that really bumpy appearance everywhere.
Yeah, and they all each give you different advice as well. But I hadn't ever been told that you could remove it, because obviously you need to see a doctor to do that. That's not really what they probably specialise in, the people that are doing it elsewhere. So I think it's a really big message for anybody that's had filler and they're unhappy with it, or even people that have had filler and it hasn't gone right. They probably don't realise that they can go and have it reversed, and how simple it is to do as well.
Because otherwise they just end up waiting, and as we know with dermal fillers, I mean, most of them are very, very safe that we use generally, but you never really know when it's going to wear off, do you? You kind of, bits of it, I think we sometimes find that they just last for ages and ages.
Yeah, they do.
And the people that want them to wear off quickly, they tend to have them, for some reason, sticking around for years, and the people that want the fillers to last for ages, often theirs go down quicker, so it's one of those funny things.
It's each and everybody's different, aren't they? Like, because I've got friends that have certain things done or have done, and they've lasted a lot longer. I think it's each individual it's different for, and it's nothing worse than doing something to your face and not liking it because it's your face.
You wear it every day.
Yeah. So.
And what kind of reactions did you get? Because I remember, I remember when you were on the episode a few seasons ago, and then you were talking about it, and then a lot of people started talking about it and saying that they really loved that you'd taken it out, or had those fillers removed and dissolved. Do you remember the kind of reactions that you were getting when you had that done? Yeah,
the reaction was really positive. Obviously, I did used to get quite a lot of stick, because I started off with big lips, and then I had filler put in as well, so my lips were massive, but I didn't really notice. I didn't really care.
You didn't care?
But so obviously when I had them taken back down to their natural size, I had like a massive response on social media and from friends and family who were saying it looks so much better to be natural, and I think a lot of people don't realise that you can do that if you've made that decision to go and have bigger lips. If you don't like it, or I don't know, times change, fashion changes, you can go and have it taken out or corrected.
Absolutely. And I think it's quite a boost as well sometimes when you're using that kind of thing as a crutch, isn't it? Because we use it as a crutch sometimes, that we've got fillers or implants or some kind of surgery, and sometimes having removed it and had a really positive response, it's quite a nice message for the person to get, isn't it? Like that you have natural beauty that people are appreciating more than whatever you'd actually
definitely
tried to correct. Obviously, I'm not saying people shouldn't have them, because when done correctly, of course, they do improve a lot of people's appearances. But when it gets out of hand and you get repeat procedures, that's where the problems happen. I'm actually going to give you a lip filler today, though.
Really?
Yeah. I know you haven't asked me to, but I'm going to. Don't worry, it's not going to go on your lip. But I'm going to give it to you just so that you can see what it actually looks like. Do you actually know what a lip filler is, or what it's made of, or what it looks like? Because obviously you've had them, how many times?
Yeah.
Loads that we can't even count probably. But do you know what it is, or what it would look like?
No.
Okay, so I've got a special little present for you, which is a little bit of lip filler right here in a syringe. And I'm going to give it to you so that you can actually see. So why don't you just squirt it onto the back of your hand, so you can do the injection. I'm taking the needle off so you don't hurt yourself.
Yeah, no, so I'm scared of needles, believe it or not.
And you can squirt, hang on, can you get, so you can squirt that there and see what it looks like. That's what it is. So that's what it looks like. It's not some weird implant or anything, it literally just is.
Like a gel,
jelly. Like a gel.
That's really weird, isn't it? Because I think people think that it's like an implant of something. You know, like when they talk about it in a negative way, and they think you've got like an actual hard implant.
They think it's a filler that you have, like some thick thing that's sitting in there.
It's mad that's what it is.
It's actually the smooth, colourless gel, and that's why we need it to be quite smooth, because it needs to integrate into the lip and kind of just become really natural.
Yeah.
So that's what it looks like. So there you go.
Well, I'm glad this is on my hand and not in my lip.
I know, definitely.